Hi, my name is Sarah Panther, and I'm here with my partner Yusuf to talk to you about our capstone project, the Smart Asthma Inhaler, tracking inhaler usage and asthma triggers. Our group members for this project were Jennifer Lee and David Chang, and our mentors are Dr. Pietro Paparella, Dr. Wayne Kimura, and Dr. Pierre Murad. So, a little bit of background on asthma. It's a hugely impactful public health issue. In the US alone, it affects 26 million people. That's around 1 in 13. In 1 year, it causes 14.2 million doctor's office visits and an additional 1.8 million ER visits. It kills 3,500 people and causes $82 billion in economic damage. In light of the current pandemic, it increases the risk of COVID-19 hospitalization for children by 3 to 6 times and disproportionately affects lower income populations due to the fact that they live in more vulnerable areas and have less access to medical care. These serious results can be mitigated by avoiding asthma triggers. So when physicians help their patients manage their asthma, it's very important that they know how often a patient is using their rescue inhaler, at what times, and why the patient uses the inhaler. Is it preventative to treat serious symptoms? What are the environmental conditions surrounding these usages? And this burden is entirely placed on the patient. Modern asthma inhalers at best only record doses used, and they're difficult to use, especially for children. 97% of children misuse their inhalers. To address the issues of modern asthma inhalers, Dr. Paparella and Dr. Murad developed the idea for a smart inhaler system, which would monitor the environment for asthma triggers as well as record automatically when the patient's rescue inhaler was used. For this idea, they won the Amazon Catalyst Award. When our team started working on this project, we decided to divide the system into 3 distinct parts: a smart inhaler, a wearable environmental sensor, and an Android application. So when the patient used their rescue inhaler or the smart inhaler, the date and time would automatically be recorded in the Android app. Then, the Android app would request weather data from the internet and save that with the event, and request environmental sensor data from the wearable sensor. This would record temperature, humidity, and particulate matter local to the user, and then save that data in the Android app as well. Then, the patient at their leisure could annotate any of these past events with any important information that they saw fit. For example, maybe they used their smart inhaler when they went into a pet store. Finally, the Android app would generate a usage report that the patient could share with their doctor during any appointments. So next, I'm going to turn over this presentation to my partner Yusuf to go over our prototype.
Thank you, Sarah. We built our smart inhaler and the wearable sensor using the STM32 microcontroller, which is a small computer like the computers used in toy cars. When the user uses the inhaler by clicking on this button, the inhaler records and sends the timestamp to the Android app. The app displays this timestamp and uses it to retrieve weather data from the web and sensor data from the wearable sensor. The user can then annotate the inhaler usage with a description like it works and export all of the inhaler usages as a CSV file by going to the settings menu. We hope our asthma inhaler will improve the lives and health of asthma patients and consequently community health overall. In studies using a similar product, participants reduced the rescue inhaler usage by 82%, they doubled the number of symptom-free days, and reported a 19% increase in the number of symptom-free nights, and 29% of participants with uncontrolled asthma regained control of their asthma. All of this is very important because rescue inhalers are used when a patient gets an asthma attack. And so from the decrease in rescue inhaler usage, we can infer participants suffered significantly less asthma attacks. We hope our inhaler will be more helpful to patients because of our wearable environmental sensor, which measures temperature, humidity, and particulate matter in the patient's immediate surroundings. And in future iterations of this project, the wearable sensor will be used to send real-time warnings of asthma triggers in the patient's vicinity. This will allow the patients to sidestep these triggers and avoid unnecessary asthma attacks. And finally, concurrently to our development of the information tracking system, another team built this nebulizer, which is a revolutionary drug delivery mechanism. It vaporizes liquid albuterol so patients can breathe in the medication more comfortably. This will be especially helpful for children who will be able to use their inhalers more effectively and without using spacers. And so the next steps to marketize our inhaler are to integrate the nebulizer and the inhaler, and to miniaturize the wearable and the inhaler. Thank you very much for listening to our presentation. We hope you liked it. We are grateful to our teammates, mentors, and everybody who made this project possible.